I've had a really difficult couple of weeks in that my wife had a mammogram, which she does every couple of years, that was positive for an abnormality. And then we went to a really good board certified radiologist, like I talk about, get with your doctor, we're better together, who did an ultrasound, and it didn't look good either. So we prayed, and the next morning, the second ultrasound was done to guide a biopsy, and that biopsy was negative. It was totally normal, just a cyst, so no big deal. The doctor even said that next morning, it doesn't look the same. So I'm thanking God, maybe we got some healing in between. But regardless, breast cancer is to a very high degree preventable. There's things that you could do to reduce your risk of breast cancer. A new article that came out in the Lancet journal showed that there are medications that are being used. One's called anastrozole. And what it does is it blocks the conversion of good to bad hormone. So what it does is it limits the amount of cancerous activity in the body. Other things that will reduce the risk of breast cancer dramatically is a low sugar diet. Cancers love sugar. They love sugar. So if you can keep sugar low in your diet, you reduce your risk of breast cancer. There's all sorts of things in your diet that definitely increase your risk of trouble with breast cancer. Any kind of toxic foods, any additives, all those things, they are not helpful and they increase that risk. And there's specific compounds. The ones that I like to look at, and I think I use probably more than anything else, are indole 3-carbinol, that's I3C, or diindolylmethane, which is DIM. It's a broccoli extract. So people all know, if you eat a lot of broccoli and cauliflower, they're called cruciferous vegetables, you'll reduce your risk of cancers all over the place. It's really helpful. But there's a supplement that you can take, which is DIM, diindolylmethane, or I3C, indole 3-carbinol, which have that broccoli extract in it in a very concentrated way. So instead of eating a whole bunch of broccoli or a whole bunch of cauliflower, you can supplement with a small amount of these supplements and create a more normal hormonal balance. The article in the Lancet was talking about how certain drugs have been identified with reducing the risk of cancer. I don't think people should take drugs as a preventive step, unless there's some very, very odd metabolic specific situation. Exceptional medicine. So if somebody has exceptionally bad genetics and they have BRCA genes and they have other problems that suggest really high risk for cancer, maybe drugs would be indicated. But I would always say diet, some supplementation with DIM and I3C, vitamin X, exercise has a dramatic effect on reduction of breast cancer. So whatever your doctor says about mammogram, thermogram, ultrasound, MRI, you can take control of your risk of breast cancer by limiting sugar, increasing exercise, taking good care of your diet, and being in relationships where you feel loved and cared for and nurtured. I went through this with my wife over this last couple of weeks, and it was very troubling. It was very difficult. It's not something that you want to trifle with. I certainly didn't trifle with it myself. We got very aggressive with conventional involvement with diagnostics and made sure she was all right. And I would recommend you do that. Don't monkey around with getting checked out and making sure that you're all right. And then when you are all right, take really good care of yourself. If there's a problem, get with really qualified people. I like a book called Take Control of Your Cancer. It's a really good book to investigate putting conventional and alternative cancer treatment together. And then you can get with a really good doctor because we're better together.